Dr. Rachel Ng completed a Bachelor of Science from McMaster University, followed by a Doctor of Optometry from University of Waterloo. She had the privilege of training in Florida under top optometrists and ophthalmologists for her clinical training. There, she extensively trained in ocular disease management, such as cataracts, diabetic retinopathy. Sorry, I have a hard time to pronounce this, and macular degeneration and dry eye disease. She has a passion for indigenous health and providing eye care awareness in Northern Ontario communities after having the opportunities to serve the pediatric population and other reserves or northern townships. She has worked with the Canadian National Institute for the Blind, providing eye care in rural communities in Ontario. She is a firm believer that access to care should always be a priority. In her spare time, Dr. Ng is an avid audio bookworm who likes psychology, calligraphy, and Earl Grey tea. Okay, without further delay, let's welcome Dr. Ng.
Thank you so much for the introduction, Amy. And you did very well at pronouncing those very difficult words. A lot of letters in those diseases. So thank you. And thank you everyone for joining us today. Thank you to 105 Gibson for providing this platform where we can learn about healthcare wellness and what's available to us. I want to start off with a little brief introduction. I'm an optometrist in Uptown, Ontario, and I work at around 3 locations. So I'll put that up at the end of the presentation if you ever want to find me. I'll also put up my email at the end. So if anyone has any questions that they thought of at the end of this presentation, you can always email me. I reply a little bit slow, but I will reply, I promise. Outside of doing eye exams, I also attend T3C. And I've been attending it for several years now. So if I do run into you when the church opens up, which is hopefully soon, please say hello. Now, for this presentation, I want to go over what you can expect for a full comprehensive eye exam, followed by some information on what coverage is available. Now, the types of exams may vary based on the age of the patient and what is needed and general health conditions as well. So I'll go over a little bit of that. For the duration of the presentation, as Amy mentioned, you can ask questions anytime. So you can stop me at any time or raise your hand. If I don't see it, you can speak out loud or wave in through the camera. Yep. So let's move on to the next slide here. Okay, welcome to my exam room here. So let's jump in. Welcome, come on in, have a seat. You can make yourself at home. Now, before you make yourself too comfortable, make sure you brought everything you need for the exam. So these are a few things that we would want you to bring. One is the glasses that you use. So we want to know what's working for you, what you're currently wearing, what's not working for you. And so it's always good to bring all the pairs that you have in, whether it's for distance, for near, for both. A list of medications. So there are a lot of medications for the body that you might think may not be connected to the visual system, but a lot of medications can affect the eyes, and we want to know that. So if you bring a list of medications, that's always very, very helpful. Any list of eye drops that you regularly take, and any insurance or coverage that you might have. So an Ohip card, for an example. And we'll go over a few other forms of coverage at the end of this presentation as well. So let's begin the assessment here. You brought all these 4 things. Let's start the exam. Now, for many people, they expect an eye exam to be mostly a glasses prescription, but there are many more factors that can affect vision that aren't glasses related at all. So we'll go over a little bit of that. I like to split it into 3 parts. So sorry, I kind of switched slides too early, but there was refractive error, binocular vision, and ocular health. The first one is refractive error. So when we think of refractive error, it's more just how the light enters the eye and how ways that we can bend the light so that it enters in a way that allows for clear vision. some examples of refractive error. I have myopia, hyperopia, presbyopia, astigmatism, a lot of fancy names, but they're very actually simple terms. So myopia is nearsightedness. That means up close you can see very well. Far away is a little bit more blurry. And we're seeing this more commonly in younger children as well. We're seeing, with a lot of increased screen time, a lot of reading and near visual work. We're finding that children younger and younger are getting higher myopic prescriptions earlier and earlier. So we can definitely go into more. There are also myopia therapies that can slow down the progression of it. Hyperopia is the opposite, so that's farsightedness. That means far away you can see very well. Up close takes a little bit more effort. Presbyopia that means that's when you reach around 40, 45, 50. That's when up close tends to become a little bit more blurry. And that's when we start needing reading glasses. We also might have heard of bifocal glasses or multifocal glasses where you have the distance and the near portion in one lens. We usually don't use too much bifocal lenses anymore with the line in the middle. Now we use more progressive lenses. So that's a slow progression from the top of the lens to the bottom, and there's no line, so it's a little bit more subtle. And then astigmatism is the word that confuses everyone, but we hear it a lot, and it can be corrected in your glasses as well. Essentially, most eyes are round, circular. When you have astigmatism, the eye is a little bit more oval. And in this case, you get a little bit more glare when you're looking at, usually lights at night is when you notice it the most. So there's several different types of correction. One that you might be all familiar with is glasses. I see some of you wear glasses. You might have worn glasses your whole life, but there's also contact lenses. So contact lenses are common if people do sports. They want to wear contact lenses. A lot of people are switching to contact lenses so their glasses don't fog up, because that has been a huge issue with wearing masks in the recent year and a half. And then the other one that people don't think about as much is Lasik eye surgery. So it can do a surgery to correct your vision so you don't have to wear glasses. Now, there's always risks to surgeries. The risk is low, but it's always still there. And you would have to determine whether you're a candidate for it. So it would depend on the health of the eye. It would depend on how high your prescription is. There's a lot of questions surrounding Lasik eye surgery. So if you have questions, you can definitely ask me. But I'd say whenever I tell any family or friends that I'm in eye care, the #1 subject for questions is always Lasik eye surgery. All right, the next part of the exam I want to talk about was binocular vision. So for binocular vision, if we could read 20/20 letters with both eyes, but the letters looked like this. So you might be able to see clearly between both eyes, but both eyes have to work together. Our eyes have to converge, so go inwards. If we want to look at something far away, we need to put two images together in order for us to see depth perception. And these are just some of the ways that the brain and the eyes work together. Now, if we have difficulty with binocular vision, we might see double vision, like this image right over here. And this can make tasks like reading very difficult. You can imagine children who struggle in school. A lot of them are actually misdiagnosed as ADHD, attention deficit disorders, and it could be that, but in many cases, it's also a vision problem. So if you were reading and the letters looked like this all the time, you can imagine your attention for reading would not be that long. You probably wouldn't like reading very much, and you would probably give up early. So imagine, now for each eye, if you cover one eye, they're still seeing clearly, they're still seeing 20/20, but they're not able to work both eyes together. And this is why it's important to always have your children assessed, have a visual assessment before going to school and even throughout school, because things can change very quickly during the school-aged years. And children won't necessarily complain about any vision problems because they may not know. To them, if the world has looked like this their whole life, they imagine that everybody else believes that the world looks like this as well. So they might not complain about it, but that doesn't mean that they're not struggling in some ways to use their eyes. And the last one, I like to kind of group this all together as ocular health. So I have a bunch of fancy terms on the slide. That's not necessarily something you need to know each individual ones about, but main thing that I want to touch on was that if your vision is blurry, it might not necessarily be because you're wearing the wrong pair of glasses. And if you were to get the right pair of glasses, things would be magically clear because the eye is very complex. And in many cases, it could be disease-based that is causing blurry vision. So a cataract, for example, is one of the most common eye diseases. That's the lens in the eye. You can see kind of the lens on the slide, kind of in the center of the eye, that big white oval in the middle. That slowly gets cloudy over time. It gets yellow, cloudy, and opaque. And that's what would cause a lot of blurry vision. Now, if you put any form of contact lens or glasses in front of it, that's not going to make it clear. The solution to that would be cataract surgery. So they actually take out that lens and they put in a clear plastic lens. All right. So what coverage options do we have? And I just have a list put up here. For a part of this presentation, I did want to go what coverage is available to residents in Ontario because it can be complicated. And I don't know if I made the assumption that everyone here would be in Ontario. I could be wrong, but this would be specifically for Ontario. The first two are the most common. So I'd say 90% of the patients I see are covered under Ohip or private insurance. And we'll go over that. So for Ohip, this is the Ontario Health Insurance Plan. For those who have an Ohip card, you must be a Canadian citizen or have immigration status as set out in the Ontario's Health Insurance Act. You must have a permanent and main home in Ontario and be physically present in Ontario for 153 days in 12-month period. So the model in Ontario for Ohip at this moment is that you will be covered for an annual eye exam if you're 19 and below or 65 and above. If you're in between those ages, generally there is no coverage under Ohip. However, unless you have a specific eye condition. So I believe there's a list of 10. And so an example would be diabetes. For example, if you have diabetes, then you would be covered annually for an eye exam. There's also strabismus, glaucoma, and a few others. So if you call, your optometrist would be able to inform you which condition is covered. And now this model is subject to change in possibly the next year or so, actually. The Ontario Association of Optometrists and Ministry of Health are attempting to revamp this model because right now Ohip coverage for optometry is grossly underfunded, and it has been for a long time. And more information can be found at this website. I just put it at the bottom if you want to take a look at it. But as of this moment, as we're doing this presentation, this is the current model of what Ohip will cover, which would be an eye exam once a year for those 19 and below, 65 and above, or with a specific eye condition. So the second most common insurance are usually private insurance. So many plans cover every 2 years instead of 1 year, like Ohip. I won't go too much into detail for the slide because I know there's many different types of private insurance. For example, I know teachers have their own specific health plan that includes dental, drugs, physio, vision care, etc. One thing I always encourage people to do is check if they have coverage for Lasik. A lot of people don't know that they do have coverage for Lasik Eye Surgery. So if that is something that someone wanted to do, then yeah, definitely check if your private insurance covers that or partially covers that. Now, if you fall in between 20 and 64 and your eye exams are not covered under Ohip, there might be options for you to qualify for the next 4 programs. So this is the first one. And I realized that for all these programs, there is an application process that needs to be done to determine if you qualify. I won't go over each individual application, but I will link the website information at the end of the presentation on the last slide, because each application process is very different. The first one I want to touch on was Ontario Disability. And this support provides a few different types of support, but one of them is vision care. To be eligible, you must be an Ontario resident of at least 18 years old, must be in financial need, and meet the program's definition of a person with a disability. So they wrote sorry, this definition is taken off the government website. So this is what they defined as a disability. And it will also be determined by an ODSP. Your coverage will be a full eye exam every 2 years and prescription eyeglass frames and lenses every 3 years. So this is for Ontario Disability. Next one is Ontario Works. And so this one's actually similar to Ontario Disability. However, it is for those who do not have a disability as defined by the Ministry of Health. So you'd be eligible if you are at least 16 years of age and unable to cover immediate family living expenses. The coverage is one full eye exam every 2 years and partial coverage for prescription eyeglasses and eyeglass repairs. And it's also going to cover dependents such as children. Okay. The next program I wanted to touch on was NHIB. So for this, you must be a First Nations person registered under the Indian Act or Inuk recognized by an Inuit land claim organization. And for this, it would be one full eye exam every 2 years and follow-up exams determined by the optometrist and prescription eyeglasses every 2 years. Now for this program, I would recommend calling the optometry office and asking if they accept NHIB patients, because the office has to be registered to accept these patients. So not all offices may accept this form of insurance. You'd have to call ahead of time to make sure. And the last one is IFHP. So this is for the following group of beneficiaries: refugee claimants, victims of human trafficking, and immigration detainees helped under the Immigration and Refugee Protection Act. Here would be covered in partial coverage for prescription and lenses. The program would cover a portion, and then usually it's balance billed, so the patient would pay the balance that the insurance doesn't cover. And similarly to NHIB, some offices take this insurance, some don't. So you'd have to call ahead of time to ensure that they could bill this insurance and the exam can be covered. So that is that last one that Ontario provides. I told you I'd put all the links up. So this is for more information for the last four, because they do require an application process to determine if you're eligible for it. And thank you. I know it's kind of a shorter presentation, but I wanted to thank you. This is where you can find me. I'm a little bit on social media. I'm on social media, but I'm shy. Is that weird? Anyway, you can contact me if you'd like. If you have any questions, you can ask me now or later. But thank you for your attention. Thank you, Gibson. Thank you, Amy, for all the organizing, all the emails going back and forth.
Well, thank you, Rachel. Like, I think it's a good time to ask Rachel any question. I think even for some eyes, not a particular eye disease, but I mean overall, if anybody wants to know something, I just think that it is a good opportunity while Rachel is here, so you can ask any questions you like. Yeah, please feel free, and you can unmute yourself and then ask any question, or if you are shy, you can type your questions in the chat box and I can ask the question on behalf of you as well. So anyone?
Or show your faces. I love seeing your faces.
Yeah, me too, yeah.
Hey, Rachel, great job. I'll start with the question period. Great work with the presentation. I had a question actually for, say, if someone has like diabetes mellitus and they suspect that diabetes might be affecting their vision, where should they go? What's the first step they should take in order to manage vision that's affected by diabetes mellitus?
For diabetes, there's a few things that can affect the eye. So it can cause cataracts, early progression of cataracts, that's one. It can cause bleeding at the back of the eye. We call that diabetic retinopathy. But essentially, there's blood vessels at the back of the eye, and in diabetes, throughout the entire body, you get leaky blood vessels. So specifically at the back of the eye, that can cause more sudden vision loss. If a diabetic comes in and says, I've noticed a vision loss when I woke up this morning, that would tell me that something a little bit more urgent than, my vision has slowly gotten blurry over the course of a year. I would definitely book an exam. The exam should include dilation. So the dilation means we're putting in eye drops that open up the eye. Some of you might have had it before. It makes your vision a little bit blurry, helps the optometrist get a better view of the back of the eye where the blood vessels are. And we need to take a look to see if any treatment has to be done. Certain treatments might be laser. It depends on how severe it could be. Sometimes we watch it and encourage them to continue to manage their blood sugar, but that would be determined on a case-by-case basis.
So in terms of laser, like, is that the same procedure as like laser eye surgery, or is it a little different?
So lasers are very frequently used for several different things. So for when we're thinking about LASIK and glasses correction, that would be to a specific part of the eye where they're reshaping the front surface. We call that the cornea. And then they're putting your glasses prescription actually on that piece of tissue, that piece of clear tissue. When we're talking about diabetes, we're talking more laser at the back of the eye, different type of laser. But yes, both are lasers that are surgical procedures used for both these conditions. Different types though.
Hi, Rachel. Can you hear me?
I can hear you, Lucy.
Oh, hi, Lucy. Yeah, it's Lucy. Thank you, Rachel. Yeah, I have a question. I have a son. He was born with cataracts and he had eye surgeries at Lasik Eye Hospital when he was 7 months old. And since then, he needs to wear contact lenses in both eyes, and also on top is the reading glasses. However, one of his eyes is weak. My question is, with today's technology, would any laser surgery be helpful for my son? Like in order to prolong his eyesight as he grows older?
That's a great question. So a few things going on here. We don't actually see too many congenital cataracts, but that's interesting. So he had the cataract surgery when he was very young. What I talked a little bit about the lens. The lens is in a clear tissue inside the eye that helps focusing. If we take that out, the ability to focus, so looking from both distance to up close, we're not able to do that. So that's why he has both glasses for distance and near. It allows him to focus at several different distances. And now you also mentioned one eye is weaker than the other. This could be because of several things, especially for I mean, it would be a very specific case, but do you know if one eye has a higher prescription than the other, or if there's any eye turns?
Well, that's the way he was born, Yeah. So, so like the left eye was very weak, almost no eyesight.
Okay. When we have one eye that's strong and one eye that's weak, it's a little bit more difficult for both eyes to work together, right? Usually the eye that's a lot stronger tends to take over. The brain pays all the attention to that strong eye, and neglects the poorer eye. So there are exercises in vision therapy, exercises that can be done to train both eyes to work together. Is he seeing a regular optometrist annually? If not, I would definitely recommend that. And if you are, ask about vision therapy. So vision therapy is a way to exercise both eyes to work together, and train the brain to use both eyes together. Because right now, if one eye is stronger than the other, things will look a little bit more off balance, reduced depth perception, tracking objects will be more difficult. Now, of course, because he was born with this condition, there are limitations to training as well. But the younger you start, usually the easier it will be, because there is more brain plasticity when we are younger compared to when we are older. And wearing the correct glasses and prescription all the time is one thing I'd recommend as well.
Right. So in the meantime, no laser surgery is helpful for my son, right?
For laser surgery, I wouldn't recommend it, mostly because prescriptions are changing. It depends how old your son is as well. But
he is
prescriptions.
Yeah, sorry, he is an adult. He is over 25 years old.
Okay. So any laser prescription or any laser surgery would only give the best vision that your best glasses and contact lenses could give. If your vision cannot be any better with glasses or contact lenses, doing LASIK will not improve it further, because essentially what you're doing is you're putting your glasses prescription on the front surface of your eye.
Right. I see.
And so if he wants to be glasses free and not wear contact lenses, then LASIK might be an option for him.
Right. Yeah, but so in his situation with laser surgery, he still needs to wear contact lenses but not reading glass. Is that correct?
So he wouldn't need any contact lenses or glasses if he were to get LASIK surgery.
Right. So would that be helpful for my son, because he was born genetics with eye problems?
So I mean, he still would not be able. So I mean, I don't know the specific case exactly, but if you were to get LASIK surgery, it would be the exact same vision as if you were wearing glasses or contact lenses all the time.
Oh, I see. So it does not make any difference with laser surgery.
No, it would be as if you're wearing the best pair of glasses or contact lenses, but all the time.
Yeah, I see. Thank you, Rachel.
No problem.
Okay, I have a questions here from Jenny, and she said my mom has a macular degeneration for a long time. She is a member of CNIB. Will I get it?
Hey, Jenny. So for macular degeneration, there are a few risk factors. One of them is genetics. It's a risk factor, but that doesn't mean that all people in the family will get it. Main risk factors for macular degeneration is actually UV exposure. So if you can reduce UV exposure, that's a good thing. And no smoking. So if you smoke, definitely attempt to quit smoking. But besides that, those are the risk factors that you can control. It's more commonly seen in women. It's commonly seen in Caucasians, and also in older people. So those are the factors that you cannot control.
Thank you, Dr. Rachel. Thank you.
Problem.
Okay, so there's another question is it possible to correct lazy eye?
To a certain extent. So by the term lazy eye, often it refers to one eye being stronger than the other, as I mentioned before. So the weaker eye, we consider it lazy. When we're growing up, the brain wants to focus on both eyes and learning how to work both eyes together. if one eye is able to see clear and the other eye only sees blurry vision, the brain will only focus on the eye that sees clearly and neglect the eye that sees blurry vision to a certain extent, where even if you put the correct glasses in front of both eyes, the weaker eye will still not see as well. It has nothing to do with the physical eye itself. It's just the brain has learned to ignore that eye, and that's why the vision in that eye is decreased. Now, are there things that can be done? Yes, if we're young. If we start early, and that's one of the reasons why eye exams early is more important, to treat children early, because if we catch these, then we can treat them early. And there are several therapies that can be done. So one of them that is most common is actually patching the good eye. So if you cover the good eye and you force the child to use the poorer eye, then the brain will slowly develop those connections, and it will strengthen that poorer eye. So that's just one example. Each case is a little bit different, though. I don't know if that answered the question. Or did I just ramble?
No. Okay, I have a questions for you. So nowadays we are all locked down. So a lot of people have so many screen time, especially the children. There's lots of parents. They say, oh, we should get a Blu-ray glasses to help to reduce the Blu-ray. I'm not too sure. Is there any research to prove that that helps? If so, I think for adults, we need it too, right?
That's a great question. For blue light glasses, it's not a magical lens. Essentially what it does is it cuts out blue light, which is a little bit more high energy light. And now there's not very strong evidence that helps reduce any long-term eye diseases or even eye strain. But some of my patients have found it very useful, and it's not harmful at all. One thing that I do recommend is if you put your screen on night mode, or sometimes it's even called blue light blocker, that's essentially putting the blue light blocker on your screen itself. So if you find that helpful, then you would know for yourself that a pair of blue light blocking lenses might be comfortable for you as well. If you don't find that helpful, then move on from the blue light blocking glasses. It's a bit anecdotal. Generally, I don't recommend it unless their main concern is eye strain. Then I'd say this is something that you could try. It's not expensive, it's not harmful, and some people find it more comfortable. It does help people sleep better at night, though. That is evidence-based. So if you have trouble sleeping after using your screen, then I would recommend using the blue light blocker.
Thank you.
Rachel, it's Lucy again.
Hi, Lucy.
Where can we find those blue light blocker? Is it a built-in thing in the computer, or we have to go to the store and get it?
So are you talking about putting your screen on night mode or getting the filter on your lens? That would, I guess I'm not techie, but I believe you'd go into settings.
Oh, okay.
And where you adjust your screen brightness.
I see.
Usually they do have an option for blue light blocker. It's also on your phone as well. If you go to display on your phone.
Yeah. Okay, I got it. Thank you.
Oh, yay, Rachel. Really? Are you trying it right now? How do you like it?
Me?
Yes. Are you trying it on your screen right now?
No, I'm not good with computer, Oh,
it's okay. Me neither. But yes, almost all laptops, all iPads, phones would have that option. I have my phone on blue light blocker. It does make your screen a little bit more sepia toned, a little bit yellow, if you don't mind that.
So Rachel, do you have any good exercise to teach us? Like, for example, when we look at the screen too long, or we feel tired or strained, so what exercise can we do?
Especially for kids as well, because now kids are doing online school and we're looking at screens for longer, even when we're 5, 6, 7 years old. The main thing is taking breaks. So it's very difficult to practically limit the number of hours you're on a screen. People work from home, people have to do online school. It doesn't make sense, especially during this phase of life, to say, you know, only 2 hours of computer a day, because that's just not practical. But the main thing is taking breaks. So every hour or so, try to look somewhere far away. Try to look somewhere, you know, even out the window, and let your eyes relax instead of focusing up close all the time. For adults, this generally doesn't change our glasses prescription, but for kids, when we're doing that when we're looking at screens very closely for many hours, it tends to increase the prevalence of nearsightedness. So that's the main concern, especially for kids. But yes, how ironic, we're all on screens right now.
No. And what about dry eyes?
What about dry eyes? there's many things for dry eyes. It's one of the most common concerns. And I'll bring this back to screens as well, because we tend to blink less when we're looking at screens. This goes for our phones, our computers, the TV. This goes for kids and adults. We tend to blink less, and we tend to blink incompletely. So we blink partially through, but not to the very bottom, and then the bottom part of the eyes dry out. So one thing is to be very cautious about blinking. Now dry eyes it's a huge range. So some people have a little bit of dry eyes. They add a few artificial teardrops, and they're comfortable. For other people, it's extremely dry and uncomfortable, and it hinders their quality of life a lot. And there's a range of therapies that can be given, but I would definitely recommend booking an appointment to have that assessed, because there's different treatments for different people.
Rachel, it's Derek again. I got some questions actually about sunglasses. So like, sometimes I hear some news say like you wear sunglasses during the summer, but sometimes people say during the winter. When should people wear sunglasses? Should we wear it at certain seasons or all year long?
I'd recommend all year long, because I mean the main protection is UV protection, and that's not going, like UV isn't going to disappear in the winter. In fact, you might even get a little bit more because you get some reflection off the snow. But I would recommend it all the time, especially for kids as well.
And how do we know something provides UV protection? Like on the if I go to a store and I buy a pair of glasses and it says UV protection, trust it, or should I get a pair of glasses from like an optometry clinic?
So for lenses, there's a big range of quality. If it says 100% UV protection, it has to, because they have claimed that. The difference between the ones you get at, say, a higher end optical store and say one at Shoppers Drug Mart or a gas station is the type of UV protection. So it's for the gas station or Shoppers Drug Mart kind of brand, they have a spray-on UV protection layer. So it is 100% UV protection, but it will wear off over time with wear and tear of the lens. For the more expensive ones, it's a physical layer in between two pieces of glass that make up the lens. So it is higher quality. It will not wear out over time, but of course you're paying more for it. So I mean, I believe any is better than none, but long term, I would recommend getting a higher quality pair of UV protection sunglasses.
Thank you.
No problem.
Okay, so I have a questions here. It's from Alice, and she say, my lens implanted for the cataracts have UV protection. Do I have to wear sunglasses? Usually
I recommend it either way, but you're right, the intraocular lens does have UV protection put in. It's more also for comfort, sunglasses as well. So the tint definitely makes driving more comfortable, reduces the glare coming off the road. If you are near water a lot, polarized lenses make your vision a lot more clear. and less halos and glares along the water. So there's that benefit as well that your cataract lens would not provide. But yes, you do have that extra pair protection, UV protection with that lens in, which is great.
Sunglasses come in different colors. Does it matter what color?
Certain glasses, as in the tint of the lens?
Yeah, they
Mm.
offer different colors. So which color do I prefer? Some
Mhm.
say gray, some say brown, like that.
In regards to health, it wouldn't make a difference what color you choose. It would be completely up to your preference and what you like the world to look at. Choosing gray tends to produce the least color distortion. So a lot of people like that for that reason. But in terms of health-wise, the main thing is that there's UV protection. But any color would be great.
Here's another one. Apart from eye drops to relieve dry eyes, will supplement like omega-3 help? And what brand of omega-3 you will recommend?
Now, for omega-3s, it would only help if you have a deficiency of omega-3s. So I guess I'll say that to start. If you don't have a deficiency of it, then it wouldn't make a difference to supplement for it. I usually recommend getting omega-3s in the regular foods that you eat. So fish is one main source that you can get it in. Fish, nuts, those, like getting it naturally tends to be the most effective way, and most people find that it's just easier to incorporate into your diet as well. But yes, omega-3s can definitely increase the comfort of the tear film. If you are deficient in it, a lot of people will have dry eyes because the oil component of their tears is not as prevalent, or it will not, the oil component of the tears make the tears more stable. So if there's no oil, then you find that your tears are kind of running off your eyes. It's more of a watery viscosity.
So any more questions? So maybe I'll just take 1 minute break because we have a little survey, but while we're doing the break, just think about like questions because we just take the opportunity that Rachel is here so that she can help us to answer a lot of our questions. But I would like every one of you, if you can take sometimes I will pull out questions. So if you can answer these questions to help us, help our center to plan our future promotion so that when we have any health talk, how easy we can like reach out to you guys. So please help us to fill in the survey. I'll just give you like a 20 seconds.
Ooh, what should I put?
It's easy. You just tick the box and nobody's know where are you from. But yeah.
Oh wait, I thought I could vote. Never mind, I can't vote.
yeah. I think host, if you are a host, you cannot fill in.
Yeah, no.
Yeah.
I only see the end polling button.
Okay, last 5 seconds. 5, 4, 3, 2, 1. All right. Thank you, everyone. Okay, so all right. Okay, so back to Q&A. So any more questions for Rachel?
Do supplement like blueberry lutein help the vision health?
So I heard blueberry.
And lutein?
Lutein, okay, yes.
Do these help our vision health?
So I'd always recommend a healthy diet in general, but in terms of taking supplements, it would only make a difference for lutein. The main thing that that would be if you have macular degeneration, and for those at risk of macular degeneration or have mild or moderate macular degeneration, some supplements are recommended for that specifically. But if you do not have those conditions, there's not too much evidence that taking additional supplements would improve your vision in any way. I mean, blueberries are great for many other reasons, but I wouldn't say that evidence supports that it would improve your vision or prevent certain eye conditions.
Okay, I have another one here. My eyesight is not very good at night. What kind of supplement you would recommend?
So that would depend on the reason why your eyesight isn't clear. So there's several different types of things that could cause that. It could be cataracts. So cataracts tend to decrease contrast, cause a lot of glare, especially at night. And in that case, there aren't any supplements that I would recommend, because no supplements are going to change that. So I guess it would depend on the type of condition that's causing the blurry vision. But generally, these conditions are treated more with lenses or surgeries, but less so diet. Although diet is important in general, but for these specific conditions now.
And what would you recommend for people with lattice degeneration?
Lattice degeneration. Okay. So, I mean, this condition, for background, the back of the eye, we have nerve tissue. It's almost shaped like a bowl, the back of the eye. So we could get holes, tears, or anything like that at the back of the eye too. One of the things that you can see is called lattice degeneration, and that's just a little bit of scar tissue kind of on the edge. And then it's generally, we just watch it and no treatment is needed. But it just puts that person at a little bit of a higher risk for holes or tears at the back of the eye. It's almost like a weak spot in that nerve tissue. So the main thing is for that person to be aware of symptoms. Main symptoms being many flashes of light, almost like camera flashes, many floaters all at once. So you have a few floaters, that's fine, that's normal. But if you have many that come all at once, that could be a sign of a hole or a tear. Or a curtain coming over your vision, that would be a sign of a retinal detachment. So the nerve tissue almost completely comes off. And if you notice any of those, to get medical attention almost immediately. So either go to an optometrist or ophthalmologist or emergency center, because that would have to be treated. The chance of that happening is very low, but the cost is high. So it's good to be aware. But lattice degeneration alone would not be treated. It just is a risk factor for any holes or tears that could potentially in the eye in the future. Tends to be seen in more nearsighted people. If you have a high nearsighted prescription, it tends to be more common in those prescriptions to have lattice degeneration.
Hi, Rachel.
Can I see?
Yeah, it's Lucy. Do you mind telling me your office?
I don't know if my screen is still shared. Is my screen still shared?
Yes.
But I do have, so I'm in 3 different locations around the GTA. Warden Optometry is the one that's right by Gibson. So it's kind of across the street. The other 2 are a little bit farther away. It depends on where you're located. But yes, I am 50 steps away from Gibson building.
Okay. Yeah, that's good. Yeah.
And way too close to the Chatham and Alley.
Yeah. Oh, okay, I got it. Thank you, Rachel.
No problem.
Okay, we still have times here, so yeah, please, if you can think of any questions. So I'll just let you guys think about it, and this is I want to share with you something with our center as well. So give me 2 minutes for we have to do some. Let me take over your share screen. Take over your screen
Yeah, no problem.
first. Yeah. To continue. Okay. Yes. Okay, first, I would like to welcome those who are with us for the first time. If you don't know 105 Gibson Center, we welcome you for tonight for your first talk with us. And I just want to introduce you for another talk with 2 days later in May 8th, Saturday, 10 to 12. But this time we'll talk about the healthcare system in Ontario, not eye care, but healthcare. So if you have any friends or any family members, maybe they are new to Canada or new to Ontario, you can let them know we have a talk, and in the talk we'll discuss about like how to find a doctor here, where is the closest hospital that you can go to, or how to find a specialist. And next, Gibson Center, some of you know, we offer different service to people. So we have community classroom, we have our food bank, we have health services, we have senior service and youth service, and many more. So if you'd like to know more about our center, you can go to our website, 105gibson.com. And if you want to ask anything, you can just send us email for info@105gibson.com. For any health related or questions for today, if you somehow miss Rachel information or email, you can contact me. And my email address is amyleung@105gibson.com, or you can give me a call if you miss anything. All right. Okay, so back to the Q&A. So any one of you still have any questions? Please feel free to ask.
Right, I got a question about cataracts. Okay, so if someone has a cataracts, what's the best process to help get this treated? Should they go see an optometrist first, or should they go see like, ophthalmologist in a hospital?
So for ophthalmology, it's a little bit more difficult to have accessibility. Usually you would go to their optometrist first as their primary care provider. And then at that time, they would determine whether cataract surgery is the ideal way to go, because it might not be. There are certain risk factors where people would not want to get cataract surgery, even though they have that cataract. And then what would happen is if they do want to be referred for cataract surgery and they are a good candidate for the procedure, we would send a referral to an ophthalmologist. And that's usually the faster way to kind of get them in line to get cataract surgery.
And which hospitals do you recommend for cataract removal?
There's several. I mean, I guess close to where we are, there's like, or around the city. For a lot of my clinics, we refer to Uptown Eye Specialists or a Clarity Eye Institute. Less so in the big hospitals. So things like Sunnybrook would be only for if there's a pediatric cataract that needs to be removed. So, you know, like the big hospitals like Toronto Western, those would be more for more complicated surgeries. But for general cataract surgeries, there's a lot of private offices as well that would do it. Has anyone here or know somebody who has had cataract surgery?
Yeah, my son has
Oh yes, you have to do some.
cataract. Yeah.
Mhm.
Yeah, my grandmother had her cataracts surgery done about 3 years ago, and it was done at Sunnybrook, and it was quite successful. So it was also
Okay.
for most of her eyesight. She says her eyesight is probably even better before she had glasses. So just very thankful for that.
Okay, yes. So I mentioned we take out the blurry lens and replace it with a plastic lens. That plastic lens also has their glasses prescription put in. So in many cases after cataract surgery, you don't have to wear distance glasses anymore, or perhaps a light pair in some cases, and then you'd only use reading glasses. There are some new fancier lenses that are coming out that are for both distance and near as well. So that's an option as well. Those would not be Ohip covered though, so.
Rachel, like for cataract surgery that you just mentioned, you know what they would put in the plastic lenses. So how long is that plastic lens good for? Like let's say if a person has the plastic lens installed in their eyes at age 60, would it be good for the rest of the life? Or is only good for 20 years?
Yes.
So it would be good for the
So
lifetime.
generally it would be good for life, yes. You can think of it as a prosthetic, any prosthetic replacement. So I mean, that doesn't mean there can't be complications. There are some situations where, you know, they had the new lens put in, they had trauma to the head, that lens got dislocated and they'd have to replace it. But those are rare instances. In most cases, they put the lens in, it's sturdy there for life.
I see. Thank you.
No problem. Things to look forward to, right? Cataract surgery. Almost everyone, if we live long enough, will get cataract surgery, most likely. Main thing to prevent progression, though, UV protection, and actually very similar to macular degeneration, no smoking. And if you're diabetic, to control blood sugar levels. Those are things that can increase cataract progression early.
Okay, so Rachel, do you know, like, if I don't know how many of the our audience has children or young age children or not adult children, but if they want to study optometrist, you know, is it they just apply to a particular university, or they might have to go for, like, you have to study the science first and then go to a specific faculty? And also, I know not all the university provide optometrist program, right? Do you know anything about this, so you can share with us?
No, that's a great question. So for applying to optometry, you would need an undergraduate degree, so either 3 or 4 years. And there's a few prerequisites that would be needed to apply, and those prerequisites would be determined by the school you're applying to. In Canada right now, there is only Waterloo that is teaching optometry in English. And there's also the University of Montreal in Quebec, but they only teach in French. So right now for Canada, Waterloo University is the only option. They take about 90 students per year, and the program itself is 4 years. After 4 years, you get your doctorate of optometry, and then you'd have to complete 2 board exams and a jurisprudence exams and get the licensing done. A lot of people can also go to the States to do optometry as well. There's quite a few colleagues I have that studied in the States, and then they took the Canadian board exams and they work in Canada. There's a lot more options in the States. Canada only has one, unfortunately. They keep talking about opening up another one, but that never happens.
Yeah. Why is it that difficult, you know? So limited.
I don't know. I think,
yeah.
Like UBC and Calgary, I think we're talking about at some point, but it just never happened. Yeah, I think finding faculty is one of the hardest for establishing a program like that. But that's just my guess. I don't actually know. Do you know anyone who's interested in going into the program?
No, I don't know, but sometimes I heard people like keep talking, oh, my son or my daughter is interested, but at the end, I don't know, but yeah. But I'll once in a while heard people saying that, oh, I want to look for like optometrist program or things, but I know like Canada is very limited. Yes, yeah, and the competition, is so big, yeah.
I think like applying to any program, it's a lot of, I don't know, like a lot of many different steps. But I do like talking to students, and I'm happy to answer any questions that students may have. I like doing some talks with students as well, who are applying to optometry school. So I did a talk like not too long ago, maybe two weeks ago or something like that. And that's always a lot of fun.
No more? Okay. So if no more questions, I would like to end our time here. Again, on behalf of 105 Gibson Center, we truly appreciate, Dr. in your time to be with us. We know that you're busy, and but we are so thankful because you just come to us and say if we need anything, and you're willing to give us a talk to the community. So we are so thankful, and thank you very much to you.
No, thank you.
Thank you.
I'm glad to be able
Thank
to
you,
talk to you.
Amy.
And we're so
Good
close.
night.
Bye.
Bye.
Right across the
Thank you,
street.
everyone. Thank you.
Thanks for coming, everyone.
Thank you. So please keep following us for all our health talk in the future, either in our Facebook or 105 Gibson website. So may you all have a good night.